Introduction. Hemolytic disease of the newborn, HDN, also known as erythroblastosis fetalis, is a blood disorder in an infant which occurs when there is an incompatibility between blood types of the mother and the fetus. HDN was responsible for the death of 1 out of 2,000 births. However, the current mortality rate has greatly decreased, so overall survival of infant born with this disease is now 84 to 90%. Transmission. Rh-positive father and Rh-negative mother may have a chance of conceiving Rh-positive baby. This isn't a problem during the first pregnancy with Rh-positive child because the child's blood circulation is separated from the mother's body during pregnancy. However, during birth or abortion, miscarriages, and amniocentesis diagnosis, Rh-positive blood cells from the fetus are able to enter the mother's bloodstream. The mother's immune system recognizes the cells as foreign antigens and develops anti-Rh antibodies against them. In a subsequent pregnancy, if Rh-positive baby is conceived again, there is a risk that it will develop HDN because even though the blood circulation of the mother are separated from the fetus, the antibodies are able to enter the bloodstream, specifically IgG. The anti-Rh antibody created from the mother are able to bind with the Rh antigens of the fetus that are located on the red blood cell membrane, resulting on the lysing of red blood cell because of the hypersensitivity type 2. Reduction of red blood cells of the fetus causes anemia, jaundice, and brain damage. Complication of HDN. During the second pregnancy, if the rhesus-negative mother carries rhesus-positive child again, so the plasma B cells are able to recognize the D antigen, which is the rhesus-positive antigen, which are located on the red blood cells of the fetus, are able to be detected. So the B cells will produce D rhesus-negative antibodies in order to lyse with the red blood cells in the fetus. The IgM will be produced by the B cells, which are converted into IgG in order to cross the placenta. When the lysing of red blood cells of the fetus occurs, anemia will take place. When anemia takes place, congestive heart failure and hepatosplenomegaly will occur. When breakdown of red blood cell will also cause accumulation of bilirubin in the liver, as the fetus' immature liver are not able to filter the huge amount of bilirubin in the body. Diagnosis. There are several diagnoses that are able to be used in order to detect HDN among infant or baby. First is to use the direct COM test, which detects maternal anti-D antibodies that have already bound to fetal red blood cell by formation of agglutination. Second is by Rh typing, which is to test the presence of Rh-positive antibodies in the mother's blood. Third is the antenatal ultrasound to detect organ enlargement of the or fluid buildup in the fetus. Amniocentesis are also able to be used to measure the amount of bilirubin in the amniotic fluid. Postnatal diagnosis includes cord blood testing for blood group, Rh factor, red blood cell count, and antibodies. Testing of the blood's baby bilirubin level are also able to be measured. Prevention. Hemolytic disease newborn can be prevented. Almost all women have a blood test to learn their blood type early in pregnancy. If a mother is Rh negative and not been sensitized, RhoGAM or Rh immunoglobulin can be used. It's a medicine that stops antibodies from reacting to the baby's Rh positive cells. Many women get RhoGAM around week 28 of pregnancy. If a baby is Rh negative, you'll get a second dose of medicine within 72 hours of giving birth. However, if a baby is Rh negative, you wouldn't need a second dose of RhoGAM.